Amal Alaskar from Saudi Arabia. I'm a nursing administration consultant. So I'm going to present our study about the factors influencing service quality performance of higher education institution, public health program students' perspectives. So next, I'll try to make it shorter. We'll go through the statement problem, my objectives, methodology, analysis, and our conclusion. At first, service quality is defined as the difference between the customer's expectation of service and perceived service. We know all it's a global trend everywhere in universities and other disciplines. And as it's known that the quality of service enhances the customer satisfaction, motivates the intention to return, boosts the recommendations, build up the strategic, eliminates within the institution and key performance indicators, retain the student, create a competitive advantage in health education institutions at all. And in this study, the term service quality deals with the student satisfaction. We are dealing here with the student satisfaction since they are the primary stakeholders and the main customers of health education institutions. The current situation, here in Saudi Arabia, or maybe in the Gulf countries all, that the perception of students about the service quality performance of Saudi University is unknown, and there was no such a scale that can measure the students' overall satisfaction towards service quality performance, and that also fits the Gulf, a scale that really fits the Gulf student culture, specifically the Saudi culture. Consequently, we have to create and utilize a scale that measures the service quality in health education sector in Saudi Arabia. So in this study, our objectives was to reveal the perception of students about the service quality performance of the Saudi University using a modified culture higher education performance scale. And we're going to talk about this in a bit. Also, we need to compare the students' overall satisfaction concerning gender. Third, to reveal factors influencing the students' overall satisfaction towards service quality performance. And we needed to determine the association between the factors of the modified culture, higher education performance scale, and students' overall satisfaction. Throughout the literature review, we used key terms such as Gulf culture, higher education institution, public health, service quality performance, students' overall satisfaction. So here I need to go through the service quality scales that we found throughout the literature review. And we have 4 of them, like the service quality. This scale, the perception of service received is compared with the expectation using 5 dimensions named tangible, reliability, responsiveness, assurance, and empathy. The other one is the service performance, which considers performance as the only measure of service quality, and it consists of 22 items. And it's unfortunately eliminating the consideration of expectation. Higher education performance assists performance-based measuring. It consists of 6 dimensions covering 41 items that include both academic and non-academic aspects: repetition, access, program issues, and understanding. This scale is being evident specifically for measuring the service quality in the higher education sector. To make it useful for our situation, the Arab culture aspects was added. This scale designed, it includes 39 items. 19 of them are related to the Gulf culture and institutional aspects linked to higher education. 12 items are derived from the higher education performance. 8 items are from original service performance scale. So this scale adopted some items from the different scales. 6 items cover the demographic information of the students. So since various issues of the Gulf culture have been rooted in Saudi higher education system, the culture higher education scale was utilized for this study to measure the service quality of Saudi universities. Okay, I'm gonna start with or go through the method. The study was an exploratory study. The design was adapted to study the perception of students about the service quality performance of the university by using the Culture Higher Education Performance Scale. The participants were, the total was 165 students. They were selected from second, third, and fourth year in undergraduate student. Range of age group is from 19 to 21 years old. All are Saudi students. And the sample was selected from 3 different specialties in public health school, from health information management, public health, and environmental. Sorry?
Sorry for the interruption. If you want to move to the next slide, kindly let us know with the phrase next or next slide.
Oh, okay. You are doing well.
But want to know.
Okay, sure. Okay, then, so the sample was selected from 3 different programs under the public health school, which is the health information. I'll be in this slide until we finish the instrument. So I finished the study design. I'm in the participant, our sample, and I'm still here. So we physically visited the College of Public Health for the data collection and distributed the culture higher education scale to all the participants. And it was a paper-based method. The questionnaire was explained to the student, and we request them to sign the informed consent prior to filling the scale. A stipulated period was provided to them to complete the questionnaire. We had 133 students who successfully filled the questionnaire out of 167. So the response rate was like 80%. Now I'm going to talk about the instrument itself. As I said, we had modified. No, I'm still in that slide. We are in the instrument section now. In this study, we modified the culture higher education performance scale. It was originally developed by researchers named Randir, and the reference is available if anyone need to have the references list. I'm able to give them. I'll put my email at the end. So we use that scale, and with some alteration of the items under these 3 factors in this original scale. So the modified scale has 45 items. 5 of them dealt with the demographic information of the sample, and the next 39 items were they were intended to capture 3 subscales. First, the factors related to the Gulf culture, and they were 14 items. The factors related to professionalism in executing academic and non-academic activities, which was 16 items. Also, the factors related to the institutional level, which was 9 items. Maybe next slide, please. Okay, we have done this study from January throughout March of the year 2020. So next slide is about the results and analysis. What we found is that the cumulative percentage of strongly agree and agree toward factors related to professionalism was 58.6%. The non-academic activities, 54.8%. Institutional level was 46.6%. And overall student satisfaction with the service quality performance of the university was 47.4%. The alpha coefficient was measured with 0.96. So the questionnaire was reliable and rated excellent. Crumpax alpha was 0.903. So the sample size was statistically significant. When testing the sphericity, it was 0.05. So the adequacy of the sample size was acceptable. Discussion. I'm trying to finish as fast as I can. Next slide, please. So this study observed that the students' overall satisfaction towards service quality performance at the university is graded acceptable. Factors related to the Gulf culture is the only subscale graded as high quality. The remaining subscales, such as the factors related to professionalism in executing academic and non-academic activities and factors related to institutional level, was perceived as acceptable. Next, please. So going through our objectives, this is our finding. Regarding gender differences, there was no significant difference between males and females. Next slide. We measure as an objective the association between the subscale and the student's overall satisfaction towards service quality performance. And we found all 3 subscale of the modified scale showed a significant association with student overall satisfaction towards service quality performance offered at the university. Professionalism in executing issues related to academic and non-academic activity, as well as factors related to the institutional level, is found to be linked with student satisfaction. Next, please. The third is the influence of various factors on student overall satisfaction with the service quality performance. We found the Gulf culture area is observed as one of the significant factors influencing student overall satisfaction. As we said, it was excellent. The factors related to professionalism in academic and non-academic activities showed a significant influence on students' overall satisfaction towards service quality performance. Okay, thank you. Based on these findings, the study suggests the policymakers could utilize the Gulf culture subscale to be included in the service quality performance scale to assess the student satisfaction toward service quality performance of higher education institutions in the Gulf region. Next, please. So, to make this result more reliable, we are wishing if we could do it in more broad areas, like in other universities and different programs, so will be able to reach generalization. Also, if it could be done in a public, this was done in a public school, so it would be better if we also do it in public and private universities to see if there is any differences. And that's all. And sorry for the inconvenience happened in the beginning, which disturbed me a little bit. Here is some of the literature review that, and if you need the list of the literature review, if you need the tool itself, contact me in this email. And if you have any questions, if anything not clear, you can ask me, please. Thank you for listening.